Hi, and welcome to some information from MedGym LLC. My name is Gina Pongetti-Angeletti. I'm the proud owner, partner in Neurosport Chicago, as well as a co-owner in Achieve Physical Therapy in Chicago. Today, we are going to talk a little bit about ice versus heat, a very controversial topic that a lot of people have been writing in and asking me about, and specifically for all sports, not just specifically performing arts, but we definitely wanted to share it because of the hours that go in often to performing arts training, whether it's gymnastics, dance, cheerleading, figure skating, musician work, etc., and theater. We are really focused always on recovery and active recovery. And a lot of people ask questions about when to ice, when to heat, what to do. And it's incredibly controversial because traditional medicine really is into the RICE method, the rest, ice, compression, elevation. And there have been a lot of recent research, and to be frank, research for years that has stated that that is actually not the best way to treat injuries. I myself have not been doing the RICE method for probably 17 years. It just didn't make sense to me from a physical perspective, chemical perspective, reproductive cell perspective when I was all the way back in school. And then as I have been treating our elite level athletes, gymnasts, dancers, Broadway tours, and everything to world champion athletes, we have a lot of controversy on it. So I wanted to kind of open up a discussion and talk about this today. So let's talk about ice versus heat. So we're going to put things into two different categories. The first category is going to be cold treatments, and the other category is going to be warm treatments, because there are some cold treatments that kind of fall into the warmth category, and you'll understand where I'm coming from. So people ask where the RICE concept came from years and years ago with athletic trainers and PTs, physicians, orthopedics, who always want to make an initial injury the quickest possible recovery in the long run by taking that initial spike of inflammation and taking it to come down as much as possible, so that instead of recovering 4 days because you didn't do the right thing the first day, you can actually start that recovery process sooner, or you can start that uphill sooner. So let's talk about what we can do, right? And this is not all inclusive. I'm sure I'm going to be missing things, but just for conversation purposes, what is ice and how many different types of icing are there? Okay, so there is ice, just regular ice, where you physically take ice, put it in a bag, and put it on you. There is an ice pack, which is the same thing, less cold, because it probably isn't going to form as well unless you do some sort of compressive ice. There is taking a body part, your hand, your ankle, maybe an elbow or a knee, but it's pretty hard to do other body parts, and submerging them into an ice bath or some sort of a cold water thing for a significant amount of time, maybe 5 minutes. Then there is also ice baths, where after a really hard workout, somebody actually goes into ice as an ice bath as a means of recovery. That, I will tell you, is on the heat continuum as an ice bath. There's cryotherapy, which is also on the heat continuum of what it does to your body. Cryotherapy is liquid nitrogen, and it gets 240, 320 below zero for about 3 minutes. And what it does is actually takes the blood flow in your system, takes everything to the necessary functioning parts, your brain, your heart, your lungs, your organs, out of your distal extremities, your fingertips, your ankles, everything, reoxygenates, flushes them out, and then allows it to essentially, it's like fertilizing your system, if you will. And that is also on the heat continuum because of what it does in order to encourage cellular structure change as opposed to just freezing something. So as we're staying on this ice side, on this left side, what does ice do? So for the time that ice is on and how cold it is, and for about half of the time after, so everything has a half-life, like Tylenol has a half-life, medicines have a half-life, icing has a half-life, because at what point in time, if you bring it down to 50 degrees does something get, if you're normally at 90, to 70, 75, and then from there it'll get to 82, and from there it'll get to 90, and how long does that take? So a lot of research has stated that the ice works for the amount of time that it's on. It takes blood flow, it vasoconstricts, so it takes the veins and it constricts them so that not as much blood flow can come to the area, hence not as much swelling response can come to the area, so that your foot or your ankle that you just rolled doesn't get immediately really big, okay? For the first 12 to 24 hours after an acute injury, you fell on something, you broke a bone, you sprained an ankle, you tore something in your wrist, absolutely ice is phenomenal. You don't want the swelling. You want to mitigate the amount of swelling, and we do this because swelling takes a lot to get out in the long run. It limits and restricts range of motion. It will limit your function. So we do want to limit, obviously, that swelling. But it also makes you stiff because it takes blood away. Some of the silliest things that I've seen are people have shin pain or calf pain. They'll ice before they run. All you're doing is tightening something instead of allowing blood flow to come in to make it more pliable. Or kids will ice in the middle of gymnastics practice, right? They'll go to practice. They'll get off of an event. They'll have a sore ankle or something. They'll ice it, and then they'll go to an event that requires proprioception and the brain to have a connection where things are warm with blood flow. And then they wonder why they have an acute injury kind of on top of something that's been chronic. Makes absolutely no sense. They have rollers out there that they've made now with ice in the rollers. So after you work out or after you run, you're supposed to roll something with something cold in order to ice it so that it doesn't hurt as much, but yet you're cooling something that you really need to bring blood flow to in order to heal or to make more pliable. It's a conundrum and it just doesn't make sense to me, okay? So now that we've taken cryo and ice baths into the category of actual heating because it's actually reoxygenating, we have this middle area, right, where we do things called contrast things. So you can do a heat ice contrast sandwich, as we say, right? So some people do ice, heat, ice, heat, ice. So it's ice, ice, ice with heat in the middle. And what happens there is the blood flow goes away when we vasoconstrict an ice, and then we flush it back in with heat. It goes away when we ice it and we flush it back in. And that's more to help to almost like you're squeezing the sponge out, right? So that's very, very good to start to take some of the side effects of rebuilding of scar tissue and phagocytic cells and everything and flush them out. It helps with lymphatic flow, which is very important for something like a chronically sprained ankle, in addition to, of course, manual therapy by a certified physical therapist that has a lot of continuing education behind them, or chiropractors that do manual therapy, etc. But it needs to be in conjunction with something else, right? With something else hands-on. So that flush can be ice to ice, or it can be heat with ice in the middle, where you bring blood flow in to start and you bring blood flow in again at the end to again help to start reignite that injury process. Side note, Graston, which is one of the most amazing techniques, not hard in concept. You take a metal implement, you take cocoa butter or some sort of lubricant, and you scrape and you irritate, so it actually restarts that injury process for something chronic like wrist tendon issues or Achilles or plantar fascia. And when you're in the middle of constantly icing things, I mean, nothing drives me more bonkers than walking into a high school training room or a college training room, especially at these big schools that are supposed to have these amazing athletic trainers, and everyone in the world is being given bags and bags and bags and bags and bags of ice to put on something. Newsflash, if you have to ice something because it hurts, there is something wrong with you that needs to be fixed. A PT has to have their hands on you. A chiropractor has to have their hands on you. Osteopathic medicine, etc. The athletic trainer should be doing things. And if they can't and they're not manual therapy educated, then they should be sending you out to somebody that can actually put their hands on you. If you have to ice it, it needs attention. Second thing, if you have to ice it, why are you icing it? Is it because what you're doing is too much? Because you're throwing too much? And if you would have thrown 50 instead of 58 pitches, it would have been better. Or if we would have maybe done 2 hours less of practice, our shins might have been less sore. I understand elite athletics. I have been working in this field for literally 42 years as an athlete or or as a professional, and I get that you can't do 2 hours of practice and then have 2 days off. It doesn't work that way. I mean, gymnasts are doing 8 hours, 2 sets of 4 hours, and with no recovery, sometimes not even in the middle of the day or between days. But if you're icing something because numbing it is what makes it feel better, there's got to be something else that you need to be doing in order to make that. So if you're compressing and icing at the same time to help to take the swelling away, the time that should be done is immediately after an acute injury, right? If you can keep an elbow, a knee, a thigh that you can use on an arm, an ankle, a wrist wrap, where you actually compress really tightly in circumferential with ice, obviously that is going to take what the body is trying to send and make that swelling not come. But I have news for you. In all of that lymphatic fluid that goes to that area, and in all of that blood that goes to that area, when your body gets injured, we are very complex computers and we know how to respond to things. Right immediately after injury, when the body sends all of that good stuff to the area to help cellular turnover and to help immediately initiate that injury process, by icing too much, you are actually stopping that from happening, right? If someone has a sore knee and they go for a hike and then they ice when they come home, and then they go again the next day and they ice when they come home, unless you know that you need surgery for a flapped meniscus or something that's happening, why are you continuing to do the activity that continues to make you want to ice when potentially looking at your mechanics, your flexibility, your strength, your alignment is actually going to be what is going to fix it, as opposed to just tempering it with ice or just making it so that you can't feel anything, right? Okay, so now let's go to heat. Lots and lots of things to do heat, right? The first and foremost thing that provides heat is increase in blood flow. So when we warm up, when we do jumping jacks before practice, when we jog around the floor, when we physically move joints to allow the viscosity of the fluid to go from thick to a little bit thinner, when we touch things, when we roll them, when we make them more malleable, when we increase blood flow, when we irritate something with a noxious stimuli like rubbing a trigger point or sticking a tennis ball in our calf, all of that increases the local heat and temperature of the tissue, as well as makes more blood flow come to the area. So things become more relaxed, they become more pliable, nerves become more alert because the body is awakened. So heat is the most important thing to apply to our bodies if we're recovering from a strain or a sprain in order to make what we're doing better. If you are out on a 30-degree day, you get out of a cold car because the ride to the gym or the studio is only 10 minutes and you go to stretch your hamstring, you're cold. Measure yourself. Then you do just a little bit of aerobic exercise and see that you might gain 10 to 15% flexibility just from your blood flow being up. Then you actually do localized warmth, right? Where you're actually taking something and mushing it, and you're taking a trigger point roller, or you're doing tennis balls, or you're even taking your fists and you're rubbing your own quads, or you're taking a stick and you're rolling. That is also going to increase 10 to 15% flexibility. Then you can do the neurodynamic flexibility where we do joint warm-ups and dynamic flexibility before static, and you'll recognize and realize that everything in layers becomes more pliable and more open to you stretching and less guarded when it knows that there's warmth and blood flow there. Okay, from treatment perspective with PT techniques, what is warmth, right? So trigger point dry needling. Needle goes into the tissue, encourages a contraction, massive amounts of blood flow come to the area, increase blood flow, increase warmth, definite treatment. Cupping, whether you're doing fire cupping or regular cupping, what does it do? By means of negative pressure, it pulls fluid out, it increases and provides negative pressure so that lymphatics and blood flow are drawn to that area so that it actually helps with cellular turnover and the cellular turnover process, right? We have ultrasound. Ultrasound is high intensity sound waves that go in. They bang into each other when they're in your system, creating deep friction. Friction creates deep heat. Deep heat creates an anti-inflammatory response as well as local blood flow and an encouragement of injury healing, right? Can't do ultrasound over growth plates, can't do ultrasound over fractures because it's essentially vibration. Old school diathermy, right? We also have hot moist heat, right? Instead of regular heat, we also have moist heat. Moist hot packs actually allow moisture to sit on the skin, which actually makes everything a little bit more relaxed and pliable. And that heat allows the manual therapist to go in and do better joint mobilization that are less guarded because everyone's more relaxed, deeper soft tissue work without deeper pressure, so you're getting somewhere without having to address too much, right? ART, active release techniques, is a means of deep heat because it's friction. So your hand is actually staying steady on tissue, and underneath that you are actually gliding interfaces of scar tissue, whether it's muscle on muscle or scar tissue on muscle or tendon or anything, and you're allowing and realigning tissue by means of heat and blood flow coming to an area. Are you more flexible in or out of a hot tub? Are you more flexible in or out of a sauna? Same concept, is that heat actually encourages cell turnover. Blood flow encourages the natural process of turning our cells over, which is why cryotherapy is so amazing, because it actually encourages that process to just continue to go faster. So people look at me like I'm crazy. And if they go to a doctor and the doctor says, I need you to, you just had a small ankle sprain and your ankle's sore and it's bruised. And let's just say we fast forwarded because you're an elite athlete. We've done your x-ray, nothing. We've done your MRI, no tears, just irritation. And now we're going to stick you in a boot for 8 weeks, right? So if you don't move the foot and if you don't allow for blood flow to go in, whether it's isometric contractions, isotonic contractions, with motion, blood flow by means of actually putting weight through your foot, so your lymphatics are encouraged to not only send things to a dependent limb like your foot or your hand or anything, because our hands are dependent when we're standing, they're always below us, but it also encourages the flaps that return things to the heart, returning swelling, not creating pitting edema and a lack of lymphatic issues, which absolutely in people who tape their ankles for years and years, we see so many lymphatic issues. And the thing that makes me so sad about that is maybe 20 to 30% of what the body wants to send to that area to heal isn't there because of that constant compression and everyday icing and everything. It just isn't fixing and healing the tissue itself, right? Now, you pitch and you're a major league pitcher. Do you put ice on it after proactively just to make it so that you don't get sore? Depends on what part of the season you're in, and it depends on what your schedule is. As far as we're at US Championships for gymnastics and we have podium training in the morning, when we're not competing, and then the next day we compete, and then the next day there's podium and then a real workout. I mean, there's all these variants in workouts. Ice time, when you're on ice at championships and you're on ice 4 different times because of how the cycle rotates. There are some people that if you have to skate again or flip again or do whatever you're doing again, that you need to make sure that by the time the next workout comes, when you don't have proper recovery, some people just want to take some of that pain away or discourage the inflammation that is going to settle in that night before the morning to not settle in, right? So so there's a little bit of talk about heat versus ice. One of the best things that you can do for an injured muscle is touch it and rub it and stick your finger in the back of your hamstring, right? And take your calf and actually work on your calf. Take your forearm and actually touch it. You are not, unless something is completely torn and you did an inversion ankle sprain and that peroneal literally snapped in half and you're hoping that it's coming back together, which I don't know that 12 weeks is going to make happen magnetically, but rest will help tissue scar down, but it definitely isn't going to help part of that healing process. So I hope that helped. I know this is going to be very controversial. I am so looking forward to everybody's comments and questions on it. This is one of my cup of teas, and I know that this really triggers people's thought process. I will hopefully follow up with this with some scientific backing and a huge, very complicated PowerPoint for everybody to look at with regards to what all these techniques actually do. But hope that you enjoyed this video. And like I said, make sure that you treat yourself with kindness and recovery. And that if you have medical advice that you've been given, that you follow what you've been given based on the situation. Question your medical providers if you need to, and hope that they have answers as to why what they're telling you to do is what's best. And good luck with your recovery. Thanks. Welcome to the presentation portion of Heat versus Ice, Rehab and Recovery Demystified, presented by MedGym and Gina Pongeti-Angeletti, owner and founder. In summary today, we are first going to touch on the history of heating and icing and how medical professionals were taught these modalities. We're going to talk about what ice and heat relatively do with regards to physiology of cooling and warmth. And then we are going to touch on the modalities that involve both ice and heat that physical therapists currently use and some things that have been used in the past and that are more discontinued now. When speaking of the history, we have to start with Dr. Gabe Mirkin in 1978. He was the person that coined the term RICE, or rest, ice, compression, and elevation, which most people hear from their physicians, coaches, parents, etc., as it is pretty much a widespread standard of care. Even though in the past 15 to 18 years, we have had a lot of research, articles, case studies, presentations by professors on how this RICE principle may not be the best for tissue, a lot of times people are looked at as being outliers or hoodlums or people who are just trying to make things up or become naysayers for something, because people don't understand that this concept that has been around for so many years could actually not be true. Athletic trainers, physical therapists, chiropractors, physicians, etc. Research on ice is around for blocking pain, but really not for much else with vasoconstriction. And there is very, very little evidence, mostly anecdotal, of it actually in the long run causing a decrease in the amount of edema that is in the area and healing process. Quite the contrary, ice research and case studies have been done where people don't get their motion restored as quickly. They feel stiffer. They don't have their strength come back because they don't have the range of motion. Although it does take their pain away, it's not functionally restorative. The goal in the original aspects of this was not to make the patient feel pain. And we are trying, or medical professionals, of course, try to make people feel happy and satisfied with you and your treatment. So as early as medicine was around, they used snakes with electric shocks to essentially cause you a short amount of pain in order to take long-term pain away. And to this day, some people just want to make you feel better as opposed to making you actually healthier. For instance, walking out of a doctor's office instantly with a cortisone injection, or saying, let's do surgery to fix what's on the MRI, instead of actually taking the time to functionally understand motion and see if the surgery is actually going to fix the problem. Now, we call it cliff jumping. Once someone suggested it, this RICE principle, it stuck. Doctors give fast advice. It was what they were taught by their mentors, and it's really hard to undo that process. But here we are, and I feel like I am a part of that change, as I've lectured probably 10 to 50,000 people about how this is not where we should be. So we talk about the physiology of ice. There is research on ice blocking pain, but not much else. It does locally decrease muscle spasms by means of blocking that response or the guarding. When an area is numb, of course, it doesn't hurt as much. People's heart rates go down and they don't have that guarding or that systemic block. If something is numb, clearly it will hurt less, and it might reduce the physiologic aspects of guarding as well, i.e. nerve pathways and conduction are slowed down and decreased so that you don't have that hyper intense signal. There is data that shows that it does delay healing because blood flow is blocked, especially people who are icing 20 minutes every hour or doing things for the course of 2 to 3 weeks, sometimes 5 to 6 even. When someone is having a joint replacement, it's really difficult to convince people not to do it because they believe that they're straying from popular medical advice. And there are research studies also that present placebo effects. It calms your nerves, it relaxes your anxiety after being in pain. And of course, this allows you to be more confident to do activities and regain your squatting or standing or stair climbing so that you will build strength. Of course, resuming activities increases blood flow, which is actually a warming effect, which is what we want in order to increase cell turnover and return to function. Why ice might actually be good, we do have a couple of reasons. There are many professional sports teams, including the NFL, who are doing ice baths and cooling chambers for spinal cord injuries to prevent that immediate internal edema if there is a head-on collision or helmet-to-helmet contact resulting in some sort of a displaced or potentially displaced spinal fracture. If it is not displaced yet and swelling actually pushes the object out of the way, there is a chance that it can be displaced and result in permanent paralysis instead of temporary, and that's obviously a pretty big deal in medical and sports trauma treatment. The second thing is that it does prevent potential blood loss if there is a laceration or severing of a body part. So in the event that you cut yourself, in the event that you for some reason have a limb severed or have a compound fracture, obviously icing decreases the blood flow to the area so that it prevents blood loss, but we just have to make sure that we're not icing and freezing things to a point where it's actually causing permanent tissue and nerve damage. Third, it does decrease the blood flow, arterial and venous areas. If for some reason that we are concerned about bleeding out, you have a face laceration or something that's very, very deep, so making sure that loss of blood is a concern. Obviously, cooling the area does assist with that. And obviously, lastly, it will allow muscles to relax once they get over the reaction of cold. So often people will be very concerned about the cold aspect in the beginning, and then after the numbing effect has taken place, then people do say that they have a relaxation aspect because once it's numb, they don't focus on the pain as much. So modalities that cool, right? We have ice packs, we have ice cups, we have Vapocoolant sprays, compression plus cold, and then we have our cold bath and tub. So let's hit those right now. First, obviously, we have our topical ice packs. They're inconvenient oftentimes because we have to have places that will keep them cool. Sometimes they're hard and they don't get in the crevices of areas that you would really like to get to for maximum cold absorption. Obviously, the risk is that there's a skin burn or overuse of it. But it's very common for people to have in their homes because it is relatively inexpensive, and we do have gel ice packs, hard ice packs, things chemically that you can smash and compress in order to have the reaction to create a cooling pack. I know that many sports teams and athletes that have remote access carry these with them, including hikers. Vapocoolant sprays, it's spraying of this fluoromethane that instantly numbs the area, decreases local muscle spasms. This is often done for things like mole removal and wart removal. It is often also done for trigger points. If someone has a massive headache, you can do Vapocoolant spray on your upper trap or your levator, or if there is some sort of a contusion that has happened, like a knee into a quad at a soccer game, etc. As far as cooling options with cold compression, if we are compressing and cooling, if you add in the third level of elevation, you can use something like a Game Ready, which is where there is vasopneumatic compression along with cold water from ice and water in an ice tank that actually cools and compresses at the same time. Again, decreasing the blood flow to the area, so it will make somebody's pain go away, but it will definitely make them stiff, deactivate muscles, loss of strength and power for a small moment in time. Often these are very popular in athletes who are doing 2-a-day trainings in multiple sessions so that they are going to have the ability to use like a Game Ready immediately after they work out and then have a 2 to 3 hour, 4 hour break before they train again. They're trying to prevent that swelling and that pooling irritation so that they don't have as much for their second practice and can do and flip turnarounds. This is often a practice in elite athletics that obviously has people on both sides of the fence. Ice cup and massage very simply is, Dixie cup filled with water and you ice and then you rub it on the skin. It melts away just like a popsicle. So then you have to peel away the ice peel away the cup from the outside to expose the ice. This is instant cooling because the ice is in direct contact with the skin, and it's difficult to get to small nooks and crannies depending on the size and piece of ice that you have. Very moderate levels of research on how minimal the depth is of penetration of the cooling effect. Cold tubs are very popular. Often you see triathletes and endurance sports athletes dunk themselves fully into a cool area after a long workout. This, of course, is in part to prevent lactic acid from pooling and any fluids in joints from marathon run or an ultra run or a boxing event or something where you're just going to be bruised and kind of beaten up all over. It is a very quick and efficient way to get cool all through the system. But again, people don't like it very much. They actually tense up when they go in it, so their muscles are contracted while they're actually going in. It's obviously not relaxing at all. The issue is most people cannot tolerate it long enough. Research studies have shown that the average person is in it for 1 minute and 5 seconds to 1 minute and 15 seconds, although some people tolerate more. Some people obviously are only in it for 30 seconds because it's just getting over that shock. It ends up being that the penetration of cold is only 1/2 to 0.8 of a centimeter deep, which is not what we really need to get to if we're getting to deep muscle tissue. So is inflammation really the bad guy? This is one of my favorite slides. So in grand scheme of orthopedic medicine, people are always like NSAIDs and take anti-inflammatory medicine, steroid creams, oral steroids. Let's wrap everything. Let's make sure that the swelling is down, because I think people perceive that when they're swollen, they're stiffer. And if they're swollen, then they're still injured. It looks bad. People want you to be careful and cautious. And it is your body's natural response to being injured. So it's just like pain. If you were on pain medication and you ran 10 miles when you should have only ran 5, you're not feeling the pain, so you're actually doing damage. Yes, swelling is the body's natural response to irritation, overuse, or an acute injury in protective mechanism, but it is also something that if the swelling is allowed to go away, if the lymphatic system is allowed to function, if your muscles are allowed to contract, you will restore your joint motion sooner, becoming more functional, and thus then able to squat and walk and lunge and lift and move and lean and put weight bearing through a joint and heal. Of course, this is all with the precautions that if you have a fracture that needs to heal from a bone perspective, if you have a torn ligament or a surgically repaired area where immobilization is what is needed because of the surgical aspect of it, whether internal bony musculature, musculotendon junction, ligamentous, meniscus tissue, etc., then that takes precedence. But otherwise, getting motion and blood flow into an area is obviously very important. Inflammation is the body's response to injury. White blood cells, inflammatory macrophages, they clean up and they chomp away, if they will, and Pac-Man away at the injured tissue and the byproducts of the broken down cells. They repair these cells, and without blood coming into the area, there is no repair, right? So if someone is stranded and they don't have water, if another hiker doesn't come and bring them water, they can't just create water. So you need somebody to come and actually restore you enough to get you strong enough to walk out back on the path, if you will. So there are lots of articles out there about ice delaying healing because it is creating a lack of blood flow to the area. Side effect is inflammation. If you are a little bit swollen, but still the joint is functional and it's getting blood flow, is that really a bad thing? Instead of always wanting the knee to look better. People always walk into clinics and they say, wow, your knee looks great. And if the swelling is gone after your ACL surgery, but your strength isn't there, you have no good blood flow coming in, and your muscle activation, your muscle fibers aren't getting proper nutrition, what's the point of actually getting to heal? We're so concerned as a society about visually how injuries look. Oh, the scar looks bad or the bruise looks bad. But sometimes we need to get over that and say to ourselves, my ankle might be a little bit swollen, but I'm putting a shoe on and walking on it, of course, with maybe a brace or a prevention mechanism for inversion, eversion, depending on the ankle sprain or mechanism of injury, but we're getting motion. And if we get motion in, then subsequently the swelling will go down quicker. So it's a domino effect. Naysayers to ice talk all the time about after 48 hours, ice isn't really that valid anymore. So if someone is putting ice on at some point in time 48 hours after, 4 weeks after a knee replacement or an ACL. It's just a matter of potentially making somebody feel better. What I would say to that is if you have to put ice on after a walk, maybe you did too much. If you have to put ice on after a PT session, maybe the pain is telling you something. If there's a little bit of irritation, I would rather have you do other pain relieving mechanisms like heating or stim or a plethora of other things, which we will speak of, as opposed to ice. Even Merkin now says and disagrees with everything and says obviously that ice is delaying healing. We talk about delaying recovery, i.e. If you are icing things, then the tissue proliferation isn't happening, and length of stay as far as within PT or length of recovery, LORs, are actually increasing. So there are other methods that are used to reduce inflammation. Obviously, oral cortisones, where you ingest them like a prednisone. Then there's topical cortisones where you put them on the skin. Of course, absorption is an issue of how much you're actually getting in order to control it, like a topical Voltaren or even a prescribed. We can use phonophoresis, which is ultrasound that pushes it in. You can use iontophoresis, which is electric current, which will push it in. Then we go to injected cortisones, where you actually have syringes that put it exactly where you want it, whether it's in a joint space, inside of a bursa, surrounding something. You have compression, which will reduce your inflammation. Of course, currently at that time, but eventually it might not reduce it because you are untraining the lymphatic system from working. Finding someone that understands lymphatic drainage properly, someone certified, like a physical therapist who's certified in lymphatic work and or an occupational therapist, is incredibly important. Making sure that they are college educated with degrees is super important because again, understanding the entire body and how it all plays together is something that is critical. As well, someone that does acupuncture will help to reduce your inflammation. But you have to make sure that they're properly trained with their education. Also, decreasing blood flow will reduce your inflammation, but it will also reduce all the good things that go to the area too. So too much elevation is obviously also not a good thing. Now, if we're using steroid physiology, this is very controversial. There are a lot of orthopedic clinical physicians who are not doing steroid use at all. They won't do it before they do surgery on you, and they're not doing it after because it does decrease inflammation, but sometimes we want that positive inflammation response to start that injury process. There have been research studies that 30 days before surgery, if you have steroids in your system, or especially in the local tissue, you have a 3 to 5 times higher rate of having complications with the healing process, whether that be subdermal or actually on the outside of your system with regards to like scar healing. And then obviously steroids delay healing of fractures and bone remodeling. We've known this for years. If somebody is taking steroids or anti-inflammatories for something that is a bad fracture, you're actually stopping some of those endochondral ossification aspects and bony proliferation. So when we talk about the physiology of heat, we talk about a list of things. The blood flow increase and relative temperatures often go together. The fight versus flight response is obviously something we see in hikers and skiers, where we are going to have, of course, blood flow that goes to our heart and lungs, as opposed to our toes and our nose, to make sure that we function. Friction causes heat, as we know from starting fires. Functional motion activating muscles does demand increased local blood flow. Moving a joint above and below, research has stated that the blood flow semi-locally as well as directly does increase. So if you're in a cast and you move your knee around, that does help with IGF-1 production as well as hormonal increase and a change in homeostasis of the local pH. Increased connective tissue elasticity with warmth, relaxes muscles, decreases muscle spasms, and friction also may restart the injury process, which is really important to us as rehab professionals, knowing that a lot of people come to us with chronic injuries that have been treated with steroids and ice and rest and everything else. And unfortunately, the body doesn't see it as an active injury process. And because of that, it needs to be triggered so that it restarts again. There are many modalities out there for heat, and these are not all-inclusive. I just want to make sure you know that. These are the ones that we use as medical professionals, including physical therapy and rehab, on a regular basis. I'm sure this is not all-inclusive, so please don't be offended if we left anything out. Hot packs, cross-friction massage, Graston Technique with tools, ART, deep friction massage, joint mobilization and oscillations, trigger point dry needling, acupuncture, cupping, ultrasound, diathermy, muscle activation in two ways, both literal activation and use, eccentric and concentric, as well as MAT, which is a technique that's very controversial, electric stimulation, cryotherapy, hot baths and hot tubs, and infrared heat. As we're talking about moist hot packs, we want to make sure we know that they do penetrate less than 1 to 2 centimeters, so they're not for a deep heat, but yet just physiological relaxation as well as an increase in local blood flow, which can be helpful before any sort of manual therapy is administered to a client or at home when you're trying to just relax yourself. The hot packs absorb water and then they sit in the hot water, so when they're placed on, it's actually a moist heat instead of a dry heat. Fluidotherapy is something that is very old, as evident by the picture. Hot air blows when your body part is in a container or some sort of a large object, usually good for hands, wrists, feet, obviously not something for a whole leg. You can move around while you're in it, so you can do some active range of motion. It's very helpful for rheumatoid arthritis, osteoarthritis, post-surgicals, and it can also work on desensitization, such as RSD/CRPS, chronic regional pain syndromes. It is about 120 degrees, but most people don't complain that it's very hot because of the fact that everything is in motion. Cross-friction massage with lighter pressure is when a hand is rubbed perpendicular to the muscle fibers so you can break up adhesions. You can also bow the muscle fibers and plunk off anything that's kind of laying in haphazardness and not in parallel. Deep friction massage is when you're actually getting depth into the muscle tissues, pushing through the fascia. So the person has to obviously be able to tolerate the pressure in order to get to the depth that one wants, and you're actually generating an increase in local blood flow by tissue disruption with oscillatory motion. Graston Technique, as I'm sure most of you are familiar with, is a set of instruments. They are metal. You use a lubricant such as a lotion on the skin. The metal glides along the skin and the hair so that it actually can work into the depth of however hard the practitioner is pushing. This is something that needs to be done by someone that is absolutely highly manually skilled, not someone who just has decided to pick up a fake Graston tool online, as there's a lot of damage that can be done to the nerves and joints, as well as bruising. And if there's too much bruising done to the area that is purposeful in a negative way, can actually impede the healing process instead of help it. Sometimes bruising does happen if scar tissue is plunked off, if you will, but also because as there is damage to the tissue, which starts that phagocytic cell energy, again, sometimes there is local bruising with blood flow demand. Joint mobilization is something that is done by chiropractors and physical therapists, occupational therapists, and other rehab professionals. It is incredibly effective from grade 1 all the way to grade 5 in oscillations or cavitations, where there's actually an adjustment that is done. It can be done with tools or with hands. Hands is obviously the most effective way because you can feel resistance and tissue, everything from breath control to muscle resting tension. So by moving a joint into a range of motion that it should be, you can do a couple things. One, you can focus on one part of a joint and move it the way that you want it to be. Number 2, you can focus on one joint in relative motion to a joint that is next to it. And the third is that you can actually attempt to hold one portion of a joint and move another portion on it, hold A, move B, so that you're creating a relative biomechanical pattern that you need, such as ankle dorsiflexion or wrist extension in closed chain, making sure that the talus and the calcaneus and the fib and radial heads are respectively moving where they need to. It does create warmth in the area. It does create local blood flow, and it is an anti-inflammatory technique in the fact that it does actually change the local pH as well as drawing blood flow into the area. Dry needling, or trigger point dry needling, uses acupuncture needles. Let's talk about the difference between the two. Acupuncture is definitely a technique that is whose purpose is for energy, chi, flow, lymphatic drainage, where fluid and energy flows through the body, whether that's from organs to make extremities flourish, or whether that is from extremities and getting back into the heart. It does relaxation, fascial tension, etc. Trigger point dry needling is specifically for trigger points within muscular tissue areas. So with acupuncture, often the needles are left in. Sometimes there is electric stim placed on them. Sometimes they are moved around. There might be heat applied. With trigger point dry needling, the needle is put into the trigger point specifically to engage in an actual contraction, which resets the brain and body connection from the point of not holding on to sending acids to the area, the pH balance again. It restarts an injury process locally, and it also resets the length-tension relationship of the muscle so that there isn't a excessive overlap or guarding that is happening within the muscle. Cupping can be used with heat or suction, often used for suction just from a liability perspective and ease of transportation. The ability for the cups to actually pull blood from deeper into the muscle and pull muscle up to the surface lymphatics and help to flush out some of the byproducts within the system is incredible. It does increase local temperature. Some research studies have shown 2 degrees, some have shown between 5 and 6. Large meta-analysis on this has not been performed yet with regards to the therapeutic effect of the heating, but there is a warming and circulatory effect that research states is between 5 and 35 minutes. So it does help to flush if you do drag cupping, where you place the cup on, put a suction amount to it, and then actually pull it along the way. That is helpful in lymphatic drainage clients. Of course, there are contraindications, so you just have to be careful and make sure that the person you're seeing is properly trained in contraindications as well. Ultrasound is a very old technique. 1 megahertz is deeper, 3 is usually more superficial. They are sound waves or vibrations that enter into the body, and by means of penetrating, depending on whether it is going through fat, muscle tissue, or other connective tissue, it actually creates deep heat, and that heat creates an increase in blood flow. Often ultrasound is done prior to joint work and muscle work or functional mobility, so that there is a warming effect, and it's more efficient, the results that one is getting when they're doing the other techniques. Ultrasound alone and by itself, if that is the only thing that is being done, i.e. to a plantar fascia or to an Achilles, is now said to be not very effective as an independent modality. There's a lot of mixed research on that, but it is an excellent technique to be used for inflammation and warmth. Diathermy is a very old technique that is used to help with everything from arthritis to chronic injuries. It provides deep heat by radio wave to thermal energy conversion. There are very few machines that are left and that are used on a regular basis because of their bulkiness, and also because other techniques are set to be a bit more efficient without having the bulk. So an older technique, but still around and still viable. We have muscle activation. So let's separate these two into the literal activation of muscle and then MAT. So literal activation is you contract your quads. You do short arc quads, long arc quads, walking lunges, squats, etc. prior to doing manual therapy. And it's going to be more effective because there's blood flow that is demanded by that area and drawn to that area. Now, MAT, muscle activation technique, is something that was coined. My personal opinion and my 2 cents on this is that you don't have to have a specific college degree or medical background in order to be certified in it. And there are some professions that don't have a nationally governed licensure or a state governed licensure. Personal trainers are doing this, and even fitness health professionals who are kind of uncategorized. So it is in and of itself, the concept is very good, but unfortunately sometimes people will do MAT for a low back strain, and they think that if they just activate the abs or your QL or something, that it will make the pain go away. And because of their lack of knowledge of differential diagnosis and medicine with mechanics, we're missing things like joint motion, potential disc issues, fractures, etc. So technique in and of itself, fantastic as long as it's done by the proper medical provider. Electric stimulation comes in many different forms. You have IFC, you have TENS, you have NMES, and all of these are for different reasons. Some are to decrease muscle contraction, some are to increase, and like Russian stim, to actually make the muscles contract, obviously with a great amount of blood flow that is garnered, and others are to confuse the body's gate control theory, stimulating A beta fibers and all kinds of other pain blocking mechanisms, which obviously decrease opioid use. If used from home stim unit, we obviously provide them to patients at the office, but we also provide stim units for home per insurance approval or for cash pay as well, which a lot of therapy and chiropractic clinics do. It is a good way to help get through function and also increase the body's natural production of these neurotransmitters and the body's natural opioids, the endogenous opioids, which is natural. Cryotherapy is considered a warming technique. It is similar to an ice bath, but as ice baths are very controversial because it actually does not get deep enough because of the method in which it is applied. With the liquid nitrogen and how it does cool the system to 300 degrees or below zero, sometimes one can start a little bit less. It does flush body from the extremities to the main organs. It takes that blood, it reoxygenates it. There are hormonal changes. There's stimulations to your prefrontal cortex. There are stimulations from a thyroid perspective. Your serotonin levels are changed. So collagen is also, production is also increased, which stimulates healing. Now, healing can be internal damage from a C-section. Healing can be from a scar externally. But from an orthopedic perspective, it's connective tissue healing through collagen. It increases motor unit activation or cell function so that your cell turnover is just simply higher. Your daily basis of scrubbing and rehashing through your body and regenerating is increased. When you go into a hot bath and tub or submersion, you can do a hot tub or any sort of other fancy warm water device. Hot water is surrounding you and it increases local blood flow. It does provide vasodilation and relax muscles. So a lot of people, even in such like a Bikram or a hot yoga, are having the ability to actually stretch their bodies more, move their joints more because it becomes more fluid and elastic. Just a caution to that, just to make sure that that range of motion that you get is not expected when you're, again, not in that warm state.